Question number 22. Which of the following is an example of epidemic point source? A. Tuberculosis. B. Public health agency. C. Contaminated water source. D. Communicable disease pavilion. The answer is C. Contaminated water source. 23. A 32-year-old man develops chronic productive cough. He has not been feeling hungry and has lost 3 kg body weight in the past 3 weeks. On examination of his lung field, there was diminished breath sound and widespread crackles. An early morning sputum culture was sent to the lab. A. Droplet. B. Contact. C. Airborne. The answer is C. Airborne. Question number 24. 8-year-old man is diagnosed with tuberculosis in negative pressure room. Which of the following should wear a face mask? A. Patient healthcare providers. B. All people who enter the patient room. C. Person has close contact with patient. D. Family members who are at risk of infection. The answer is B. All people who enter the patient's room. 25. A nurse working in medical unit is preparing with droplet precaution measures in place. The following personal protective equipment I wear. What is the correct sequence for putting the equipment on? A. Face mask, gown, eyewear, and gloves. B. Gown, face mask, eyewear, and gloves. C. Eyewear, glove, face mask, and gown. D. Gloves, gown, face mask, and eyewear. The answer is B. Gown, face mask, eyewear, and glove. 26. Nurse working in medical unit is going out, removing with droplet precaution measures in place. The following personal protective equipment I wear. What is the correct sequence for putting the equipment off? A. Face mask, gown, eyewear, and glove. B. Gown, face mask, eyewear, and glove. C. Eyewear, glove, face mask, and gown. D. Gloves, eyewear, gown, and face mask. The answer is D. Glove, eyewear, gown, and face mask. Question number 27. Mr. X attended an outpatient clinic with symptoms of shortness of breath, diarrhea, and severe respiratory distress. Which of the following is the best diagnosis of Mr. X's case? A. Coronavirus. B. Swine flu. C. Zika virus. D. Hepatitis. The answer is A. Coronavirus. Question 28. A nurse received a telephone call from admission office of the hospital and is told that the patient with streptococcal meningitis will be admitted to the medical unit. The nurse is planning to apply infection control measures for the patient. Which type of isolation precaution the nurse must observe? A. Droplet precautions. B. Contact precaution. C. Airborne precaution. D. Standard precaution. The answer is A. Droplet precaution. A 35-year-old patient was admitted to medical ward with confirmed diagnosis of meningococcal infection. Which of the following infection control prevention that nurse should implement? A. Droplet precaution. B. Contact precaution. C. Airborne precaution. D. Standard precaution. The answer is A. Droplet precaution. Number 31. A 16-month-old child is hospitalized in intensive care unit with multi-resistant sepsis. On the third day, she had explosive diarrhea. A stool sample was sent to laboratory for scientific investigation. Which of the following transmission-based precaution is most appropriate? A. Combination airborne and droplet. B. Contact. C. Droplet. D. Airborne. The answer is B. Contact. 32. Which of the following is the most effective infection control precaution to prevent nosocomial infection? A. Hand washing before and after patient contact. B. Wearing glove and mask for direct patient care. C. Isolation precaution. D. Broad-spectrum antibiotic. The answer is A. Hand washing before and after patient contact. Number 33. Mantok test done for the patient result was 6.5 cm. It's considered A. Latent, B. Suspected, C. Active. The answer is B. Suspected. Number 34. When planning discharge teaching for patient hospitalized for treatment of the third burn over 30% of the body, nurse know it is most important to include instruction regarding the loss of large amount of serum occurring with burn and the resulting loss of immune function. Which of the following instructions should be included? A. Wash hand frequently each day. B. Wear supplemental oxygen at night. C. Wear mask while in public space. D. Take multiple vitamin tablet at night. The answer is A. Wash hand frequently each day. Number 35. An infection control nurse noticed purulent exudate, redness, and tenderness on the surgical wound site for a few post-operative patients in surgical unit. She discussed with the ward nurse and emphasized that wound infection after the surgery can be prevented. Which of the following is the best possible action to minimize the incidence of wound infection? A. Perform assessment of pain on the wound site. B. Wash hands before and after each patient activity. C. Encourage adequate intake and early ambulation. The answer is B. Wash hands before and after each patient activity. Number 36. A patient in surgical was transferred to isolation room after the wound swab confirmed to have methicillin-resistant Staphylococcus aureus or MRSA. Which of the following measures should the nurse take to prevent infection in the ward? A. Clean the wound 3 times a day. B. Discharge all soil dressing into waste bag. C. Instruct the patient to wash hands regularly. D. Wear glove and gown on every entry into the room. The answer is D. Wear glove and gown on every entry into the room. Number 37. Medical asepsis required which of the following hand washing techniques? A. Use hot water to ensure that pathogens are killed. B. Use circular motion washing from clean to dirty area. C. Rinse soap off keeping hand and forearm lower than down. D. Hands shall be held higher than elbow and scrub. The answer is D. Hands shall be held higher than elbow and scrub. Number 38. A 45-year-old patient admitted with pulmonary tuberculosis. The unit nurse placed the patient in an isolation room with negative air pressure and prepared all personal protective equipment at the entrance of the room. What type of precaution measures has the nurse activated? A. Contact. B. Droplet. C. Airborne. D. Standard. The answer is C. Airborne. 39. To reduce the risk of transmitting methicillin-resistant Staphylococcus aureus, or MRSA from an infectious wound, which of the following precautions should be implemented? A. Airborne, B. Contact, C. Droplet, D. Reverse isolation. The answer is B. Contact. Number 40. A 45-year-old patient is admitted with pulmonary tuberculosis. The unit nurse placed the patient in isolation room with negative air pressure and prepare all PPE at the entrance of the room. Which of the following PPE is the most important for the nurse when caring for this patient? A. Hair cover, B. Sterile gloves, C. N95 respirator, D. Protective goggle. The answer is C. N95 respirator.